morning, everybody. I am one of the embryologists at HART Fertility. So HART Fertility is a fertility clinic located in the Foreshore in Cape Town. And today we are doing the next installment of the HART Fertility Diaries, where we are chatting with Dr. Pickstone-Taylor, who specialized in psychiatry in the USA and finished his fellowship in Child and Adolescent Psychiatry at the University of California in 2003. Dr. Pickstone-Taylor has a special interest in gender diversity and particularly in young people. And in 2012, he started the Gender Identity Development Service within UCT, UCT's Division of Child and Adolescent Psychiatry, where he provides support for young people up to 18 years old, as well as with their families and to other professionals supporting these young people. So welcome, Dr. Pickstone-Taylor.
Thanks for inviting me. And welcome being able to share information.
Of course. So Dr. Pickstone-Taylor, would you mind please telling us about how you came to have this, your particular interest in gender diversity and basically how you ended up where you are right now?
Well, that's quite a long journey, but I guess I sat in a lecture about 20 years ago in London, or 15 years ago maybe, where they were talking about gender diverse children, and the language being used was very homophobic, and I couldn't really understand what was going on. This was a lecture to trainee psychiatrists. And then I asked the lecturer, and he said, well, in adult psychiatry, they didn't view kind of being gay as a problem. They actually did view that as a problem with children. And I suddenly realized that gender diversity in young people was sort of a backwater most psychiatrists and most doctors weren't really aware of. But things have moved on a lot since then. I took an interest in this when I was studying child psychiatry in San Francisco. And then when I moved to the UK, it was still an area a lot of people didn't know a lot of. The Tavistock is the main centre in the UK, and they seem to almost hold a monopoly on understanding this area and treating people. And so if you have any interest, you suddenly find yourself the expert, which I was in the Oxford team that I was working in. And then I moved to London, and similarly there in the trust I worked for, I had a special interest. Anyway, when I came back to Cape Town about 10 years ago, like I think anything else, if you've got a pulse and a special interest as a child psychiatrist, you automatically become the specialist in the area. But there was a great need for somebody or for people to help young people with these differences. And there's been an explosion in the number of these kids all over the world coming out at a much younger age. So there's been a lot to do. And essentially, I started a little clinic at Red Cross in 2012 that maybe saw one person every 12 months or every 6 months. But now I sometimes get 3 referrals a week. So there's a lot of work to be done. And this is an area where these young people are very vulnerable. If they don't get the right supports, about 50% of them will try and kill themselves. We don't have any group in child psychiatry where such a high percentage of a small group of people can have really serious problems. So it is an important area, and it's also very rewarding because with a small bit of input, you can have a huge impact in these young people's lives. But it does take understanding the area. And so I find it very rewarding.
Thank you for that. That's a very, very interesting journey. And on the back of that, I think it's very clear that the transgender or the trans community is a very vulnerable community. And I think the whole aim of this Q&A is to provide people with awareness and information so that we can provide a platform so that more people know more about that. So just on to the first question that I have for you, would you mind please explaining to our audience the difference between gender and sex, and within those two realms, gender identity versus expression, as well as biological sex versus sexual orientation?
Sure. Well, with any of the terms, the challenge is that different people have different understandings of the terms. So even the term transgender, for instance, if a child says to me they're transgender, I will need to ask them what they mean by that, because what one person means can be very different from another person. But what I'd like to do at this point is to just put up a slide that I think helps people understand transgender in a very helpful way, and as well as sexual orientation and all the different axes. So this slide is called the gender-bred person. And while some experts might say it's rather simplistic, for most of us, this actually is incredibly helpful in covering the four main axes of gender. You know, when I was growing up, you were either male or female, and that was the end of the story. But we know today, scientifically, it's not as simple as that. So there are four main axes of gender, and I'm going to go through them. You asked the difference between sex and gender. You know, in my mind, it's so complicated because people use them interchangeably. Really, what's more important is to understand these four kind of axes. The first one is biological sex, that purple line there, which is the body on the outside. And I do stress the outside, although it can also be inside. But basically, in terms of transgender, these are people that don't feel the body on the outside is who they are on the inside. Sorry, I'm getting a bit ahead of myself. But anyway, the biological sex is on a spectrum, as are all of these things, all the way from feeling you're from having a body that's 100% female on the outside to 100% male. But I do work with intersex kids and their families. Those are people who have bits of both biological sex, gonads, for instance, as well, male and female, and they are called intersex. One of the really important things in this area is to use terms that aren't pathologizing or make people feel less than others. So the term DSD, which is traditionally used, differentiation of sex disorder, is really not liked by intersex people, so please don't use it. Intersex is the polite term. I got it wrong at a big conference, so I've learned the hard way myself, but we should always just be open to learning. Anyway, that's biological sex. Then we get gender expression, the yellow line, which again can be all the way from typical female to typical male, and androgynous is somewhere in the middle. Toys R Us do a great job in making it very binary, either pink or blue, but that doesn't reflect reality. And, you know, with grown-ups, gender expression, you have women wearing trousers, which 100 years ago was totally unacceptable. Today, it's totally fine, and a woman can wear a suit to work, and that's completely normal and acceptable. But if a man wants to wear a skirt to work, well, people still get rather excited and might even think that they have mental health problems. But actually, in terms of mental health, it just means their gender expression might be more feminine. And I think we're going to see a big change in that coming in the next few years, judging from fashion magazines that I've been looking at recently. Not that I have a lot of time to do that. Anyway, sexual orientation is really who one's attracted to. And hopefully one is familiar with that spectrum too. Bisexual is if you're attracted to both, and heterosexual and homosexual. But really gender identity is the last and the one on the top there, which is kind of strange for most people, because most people are born with a body and they are okay with that body. It feels right to them. You know, it's either male or female on the outside, and that feels right. But for transgender people, that body doesn't feel right to them. They feel they're more on the opposite side. But even the word transgender, I always ask young people, you know, from 100% to 0%, you know, where do you feel you are? And they will say, if it's a birth assigned female, they say they feel they're 51% male or 100% male. That would be transgender. You feel you're on the opposite end of the spectrum. But very important to not assume you understand what people mean by a term and ask for clarification. Transgender or gender diverse people are very happy to educate us. As long as we're respectful and inquiring, they understand that most people do not know as much as they do about gender and all of these different issues. Genderqueer is a term that many people use to relate to a bit like androgynous, somewhere in the middle of male and female gender expression, but genderqueer is got to do with gender identity. So it could be that they're somewhere in the middle of identifying as male and female in their gender identity. And non-binary is another term that gender diverse people might use, similar as genderqueer.
Amazing. Thank you so much. That's very, very helpful. And I think it's always important, from what you've said, is that we need to realize that there is a spectrum for each of these axes, and it's okay to be on either side of them. And it's okay also to not, pigeonhole, what side you want to be in all the time. And I think that's especially prevalent with gender expression and where fashion is going at the moment, as you mentioned. And on what you did mention it as well, but a professional as yourself, you said that you did make the mistake with intersex, and how that can be offensive to some people if you're not sensitive to the specific terms. And this is now leading on to my next question about if it's rude to ask people for their pronouns. And I know that you did answer that before, but I think it's just important to really, to let people know that it isn't, as far as I understand, rude to ask what people's pronouns are, what they prefer to be called. If you can just weigh in on that.
Absolutely the opposite. It's really respectful to ask people what name and pronouns do you like to be addressed as. And I know it's a little bit strange because still today, the majority of people either use male or female pronouns, and it's kind of obvious. The truth is there's an increasing amount of young people or people coming out now who don't identify as the gender that you expect them to be. And it's also a wonderful opportunity when you say to somebody, what name and pronouns would you like me to use for you? It immediately signals to that person that you're sensitive to those issues, or at least wanting to be respectful. Even if you don't get everything right, it's a great start. Because, for instance, even patients that I evaluate, maybe they're not ready to tell their parents all about their gender because they're still a bit fearful. But the fact that I say, what name and pronoun would you like me to use? They immediately know I'm going to be sympathetic and respectful to them. And they're usually ready to tell me exactly what's really going on the minute I send their parents out of the room. So it's a great way to signal that you are respectful of that. And in fact, on Zoom sessions, a great thing to do is to put your name. I can see I haven't done it, but I keep meaning to do this. Is to actually put the pronouns you prefer, like, Simon, and then he, him would be, appropriate for me. And that immediately signals to people that you're aware of those issues. And because creating safe spaces for transgender people is so important. They are so used to prejudice and people who don't respect them and don't understand the issues, that these small signals can be very helpful. So no, it's not disrespectful to ask pronouns, it's the opposite. And perhaps wearing a rainbow pin on your coat or your jacket, it doesn't mean that you're gay, it just means that you respect diversity, and it's a little signal that can help a patient who's otherwise pretty anxious to feel okay around you.
Thank you. That's really great advice, and it really does show how important it is to use such a small tool to really make someone feel more comfortable around you and to really address that you are sensitive and respectful. And on that, we know that the trans community is very in a sensitive position, worldwide and as well as in South Africa. And you mentioned safe spaces. I was wondering if there are any, if you can elaborate on any specifically trans safe spaces in the Western Cape that exist.
Well, I have to be honest here and say that there are two organizations that I would be aiming transgender people to, which are Gender Dynamics, a wonderful NGO who have even hosted scientific conferences that my colleagues and I have spoken at. But they certainly are in touch with all sorts of things like doctors and resources that are safe and respectful of transgender people. The Triangle Project is a similar organization that provides various services, and both of those organizations do provide spaces where there are groups for transgender people to meet each other, to grow in confidence, because many people initially, it's a very solitary thing of coming to a realization that you're not kind of what everybody feels you are. And some people don't have friends that they can reach out to immediately and get support and understanding. Or even if they have friends, their friends don't understand these issues. In terms of young people, which is more what I work with most of the time, although I also do work with adult transgenders, we have a trans teen group at Red Cross that we meet once a month, which is really a social support group. And we have a group for the youngsters and then a group for their parents. We started the parents group because they all used to sit in the waiting room and stare at each other, but actually that's a really important group, because for many parents this is actually quite a trauma of coming to terms with the fact, initially anyway, that they have a transgender child. For some people, they've only known for a week or two when I first see them. For others, they've known for longer, but there are valid processes of mourning that they need to go through, of having mourning the loss of a typically gendered child. And we have wonderful parents in Cape Town, are very supportive. But anyway, there's that group for the parents, which I don't want to lose sight of, but at the same time, we have this group for teenagers. We also have a WhatsApp group, and that's also incredibly helpful because not everybody lives in Cape Town, and for some of them, they can't get to the groups. But yeah, increasingly there are other spaces. There is a bookstore in Cape Town that is really quite special. They have I think an LGBT evening once a month, and the book lounge in Cape Town. I know that is a space that many of the young people really enjoy. And Pride is a really important occasion. Many of the young people I meet say that their first day at Pride was the happiest day of their lives. They've never been to a place where there's so many young people who are happy, outgoing, totally comfortable with who they are with themselves, and it's almost like they've stepped into a new dimension. So I don't underestimate just pride occasions themselves give a huge boost to young people who've really been struggling for a very long time on their own. So absolutely, safe spaces are important, but young people create these on their own. Part of what we do is we put them in touch with each other, and they have their own get-togethers and sleepovers and occasions in people's homes. Unfortunately, not all spaces are safe. And, from the teen group itself, for instance, while young people don't attract negative attention so much, unfortunately, in townships and some areas, to be a teenager and transgender can be incredibly dangerous. And so they are careful about where they are. Corrective rape and these sort of appalling things that happen in South Africa are reality in some poor communities and even not so poor communities. So the best we're doing at the moment really is to put transgender people in touch with each other, and they're very creative at then building on their connections. But certainly Triangle Project and Gender Dynamics, I would say, are two of the best organizations. And if you are transgender, Cape Town is probably the best place in Africa to be transgender. So it's a good start.
Of course, and thank you for that info. I am also familiar with the Triangle Project, and I know that they do phenomenal work, especially in more rural areas in Cape Town and around Cape Town. And you are so right, Cape Town is a very LGBT-friendly city, one of the most in the world, some would say. And there are a lot of safe spaces like the Book Lounge, like certain restaurants like the Raptor Room as well is also a safe space. So thank you for all that information. My next, I actually just got a comment from someone on WhatsApp about what we spoke about previously with putting your pronouns on Zoom. And some people say now that on Instagram, it's also something that people are doing, of putting their pronouns on their bio on Instagram, as well as on your profile, or not your profile, so your signature at the end of your end of your email. That's
absolutely
also really good to do that. So that's also great.
Great ideas.
Just some interaction that we've got. And then the next question I want to ask you, Dr. Pickstone-Taylor, is that, as we've spoken, we know that the trans community is, it is a vulnerable community, and we are always striving to really get to a complete, acceptance and equality, and we are very passionate about that. But are there any mental issues that stand out to you when you see trans individuals, that we can hopefully raise awareness on?
Well, in terms of what I see, part of it is age dependent. I mean, if I'm specifically talking about children, the youngest children, but sometimes even teenagers as well, present with somatic problems like headaches and tummy aches. They don't go to their parents and say, I'm really anxious about going to school. They just have a tummy ache and they don't want to go to school. But as young kids grow up, they can get more clear anxiety or depressive diagnoses, and certainly adults as well. It's incredibly anxiety provoking to be out in public and be misgendered, for instance, for adults, or abused. The big problem is that if you don't get the hormones when you're young enough, and you look somewhere in between male and female, people are horrific. They shout abuse, morphine, tranny at complete strangers, or they ask inappropriate questions. And if you're a transgender person, literally, have you got a penis or a vagina from a complete stranger when you're not really expecting to be interviewed by anybody today? If you're walking around and constantly having to deal with that, it tends to make you anxious and also depressed. So, I've already said that young people by if they don't get the right supports, 50% of them try to kill themselves. Now, that's just the tip of the iceberg in terms of problems, because obviously you don't just become suicidal. Many of them become severely depressed or have high anxiety. So those are the two areas I'm looking for, and the same thing would go for adults. Sadly, what has been traditionally the pathway before hormones became available and supports for youth, most people only got these supports later on in life, and in their 30s or 40s, they'd earned enough money to pay for the hormones and the surgeries. But the problem with that is that it's quite hard to change how you look later on in life if you've completely finished puberty. And so about 50% of them don't really pass completely as the gender that they identify as. And unfortunately, that does condemn them to get this abuse on the streets and be asked inappropriate questions. And studies show that up to 40% try and kill themselves later on in life once they've had all of the hormones and the surgeries. They do hang in there, hoping they're going to fully be the person they want to be, but once it's finally they've done everything they can and they're still being abused, many of them get very depressed and, as I say, sadly try and kill themselves. But so depression and anxiety, very serious. Some people are very good at hiding their feelings from others and putting on a brave face. But certainly if we do know people who are transgender, just to be aware that those are issues. Another issue that might be there, but it's difficult perhaps to know exactly what to do with it, because one does need to be careful. It's not necessarily our role to be telling people what we think of their mental health status, but hopefully in a friendly, appropriate way. But a number of transgender people are also on the autistic spectrum or have Asperger's. I see about 30 to 40% of the young people I see also have those issues. So they struggle anyway with social communication and dealing with abuse, to be quite frank. And often one of the big things I'm doing is not just helping them around their gender diversity, but also helping them understand their social communication differences and getting them the right sort of supports for their neurodiversity, we refer to it as, if they're on the autistic spectrum.
Thank you for that. And, from what you've said, I think it's so important, to know that a lot of the mental health struggles that trans individuals do face are because they live in a society that isn't always accepting and it isn't always respectful of their sensitivities. And I think that's what, makes it so important to create awareness about this and to make sure that, people get tools on how to be more respectful, how to be more sensitive to the community. So I think that's really important to know. Another, just on my next question, people often perhaps don't mean it in a bad way when they ask, a trans individual what they think might be innocent questions. But obviously, you wouldn't ask those same questions to somebody else that maybe very well, or another stranger, on the street that maybe doesn't identify as trans. And I think it originates perhaps from maybe not understanding it completely, which obviously isn't an excuse, but I think, that's why this awareness is so important. So on that, to identify as trans, I think it's a misconception that you have to undergo some form of transformation. So either a hormone replacement therapy or surgery. I just want to know if you can weigh in on that and really, do you have to really change your body or your appearance to identify as trans?
No, I think this is a very important issue, because some people have this idea that you're not transgender until you've kind of had the hormones and the surgery, and your body on the outside looks to everybody like the gender that you're calling yourself. You're not a trans male until you've got a penis and no boobs and whatever else, which is absolute nonsense. Transgender refers really to your gender identity, and whether you've had the hormones or the surgery or not is completely irrelevant. And this is why many gender people say it's really ridiculous that doctors need to write letters to say whether you're can change your gender marker or not. The person themselves knows their gender identity. Gender identity forms between the ages of 2 and 3 years old, sexual orientation between 7 and 8. And what we know from studies is by Tanner stage 2 of puberty, if by that stage you are identifying as transgender, if not before, it's highly unlikely, 90% plus, it's not going to go away. And certainly if you are identifying as 100% male, just because you haven't got a penis doesn't mean that you're not male. And it's really unhelpful for a person like that to be referred to as female, and just because they haven't had the surgery. Firstly, these surgeries are expensive. And not everybody wants all of them. I had a young child who, I think he was only about 7, and his mother told me how, he was a trans boy, and his best friend's mother said, you can't be a boy, you haven't got a penis. And he just said, well, so what? And actually, there's a profound wisdom in that comment, because yes, so what? If I was in an accident and badly burnt and I didn't have a penis and somehow I kind of looked actually more female than male with my burns, I wouldn't suddenly become female. Whatever my gender is up here. And the studies we have now do give evidence, statistical evidence, that there's a female pattern brain and a male pattern brain in terms of size. Yes, these things are relatively crude, but they are statistically significant. Certain bits are bigger or smaller depending on whether you're male or female. And transgender people's brains, if it's a group of trans men, they follow the typical cisgendered or typically gendered male pattern brain. So really what we know from science with our best evidence is actually the brain is more likely to be the opposite sex brain. So whatever is there on the outside is frankly irrelevant. Yes, governments and people do put hoops in place. So transgender youth would need to have a letter from a mental health person and a hormone person to get their gender marker changed. But in Argentina, that's not necessary. You can go and change your gender marker on your own. And personally, I support that. I mean, there are all sorts of people who worry about men pretending to be women, but let's be real. How many people are going to go to Home Affairs to change their gender marker? There's no real evidence for that going on. But nevertheless, yes, many trans men don't have the surgery, we call it bottom surgery, to their genitals. Trans genital surgery or bottom surgery for trans women is highly successful, and many trans women have that surgery, and you can actually create a functional vagina. I mean, it's amazing what surgeons can do today, but it's not as successful. And some trans men don't feel they particularly bothered not having a penis. They still feel they're male and they're perfectly happy. So I do feel quite strongly that we need to respect people's gender identity and not judge them on the basis of what they look like.
I completely agree, and I think it's important to know that trans individuals exist on a spectrum, and it's very complex, and no one trans person is the same as the other. And I think by asking trans individuals these questions, I think we're perpetuating that stereotype that you have to be a certain type of trans individual if you are trans, which I think is very unfair to expect. So I think that's really important to know. With regards to, as you said, some trans individuals don't go through hormonal therapy or surgery. But if, some trans individuals do go through that, what are your thoughts or recommendations on if they should kind of think about their options with regards to fertility preservation? And for the viewers out there, when I speak about fertility preservation, I mean freezing one's sperm or eggs to use later on to have a biological link if you're wanting to start a family. What are your thoughts on that?
Well, I actually think it's a really important thing. Most of the kids that I see, or the young people I see, it's the last thing on their mind, as in, they're really distressed by their bodies, they're wanting hormones, they, wanting all sorts of changes. The last thing they're thinking about is having children. But that's even more why it's important to talk about it, because what we know from studies is that while 90% of them will say, oh, well, I'll adopt if I want to have children or something along those lines, there is a significant percentage that 10 or 20 years later, or perhaps even sooner, might actually be in a relationship or in a situation where they really do want their own biological children. And sadly, then there is this possibility that they will, really regret that they didn't think this through. So in my job, anybody going on hormones, I do bring up the topic. Usually, while I do a massive one-stop shop in terms of evaluating them, getting feedback and all the rest of it, I tend to leave fertility to a second appointment because it's a whole new kind of thing to think about and a bit overwhelming. You know, parents have strong opinions and sometimes I think are a little tempted to say, well, listen, we'll give you the hormones if you hand over some eggs or sperm first for the bank. And I have to, of course, explain to them that's not a good idea. But nevertheless, they might want grandchildren. And whereas the actual child just wants to, not have their voice drop or stop their periods or not have any more breast development. So it's a difficult interface. But what we know is even if you do have these conversations and the child makes the same decision to say, no, I'll adopt, or I will risk it that my reproductive organs will still work if we stop the hormones, which of course that is an option that some trans men have managed to carry babies later on to term. Even if the decision is the same, which is not to preserve fertility, in the future, they will feel better in 20 years or 10 years time if they're one of those people who actually then do want to have their own children, because what we don't want is people in the future saying, I wonder what decision I would have made if I'd had this conversation and I'd thought through all the possibilities. So they are less distressed if you have had that conversation. Of course, yes, there are some who do want to preserve their fertility. Unfortunately, it is very expensive, as probably all of you will know far better than me. I think it's something around 50,000 Rand for preserving eggs. But some people are fortunate enough to be able to afford that in terms of their family supporting it. Insurance doesn't support it as far as I know, but there are a couple of young people and it makes a big difference in terms of them preserving their fertility. If they both assigned male, I pretty much always, encourage them to make a sperm donation if they possibly can, or in any way ambivalent, but I certainly have the conversation with them because I don't want them later on feeling, gosh, I wonder, if I'd preserved, if I'd thought about it, if I would have preserved some sperm. So I feel it's mandatory with anybody who's about to start hormones, both myself and the pediatric endocrinologist or the adult endocrinologist for that matter should really discuss fertility, because it's not number one in these people's minds at all. It's usually not there at all, but later on in life, it could have a huge impact. And, we are human beings. We're these weird creatures that at different times of our life feel differently about reproducing. And it certainly is a strong drive for some people. And many of them don't know the relationship they're going to end up in. Some of them might end up with a man or a woman, and it's totally clear when I'm seeing them, and there are all sorts of combinations that could be important to them later, either using their sperm or their eggs or with their partner in some sort of way in the future.
Yeah, you've summed that up so well. I mean, you never know what they might, want in the future. And if one doesn't want kids, that's also okay. And if one does want kids, that's also all right. But I think it's important to have the conversation around fertility preservation. And it's almost from a medical side, perhaps our duty to really open that conversation, because as you said, often trans individuals are posed with this question when having families or having a family isn't something that they've even considered yet. So the answer isn't straightforward, and there are a lot of different ways to go about it. We are very passionate about our fertility preservation, and especially with trans individuals. And our doors are also always open. We have very knowledgeable fertility specialists that can help chat and provide their insight with that. As you said, egg freezing is quite costly, and that does obviously affect the availability of the treatment. And also, as you said, donating sperm for freezing, so freezing one's sperm, is a lot more affordable and somewhat easier in terms of the logistics. Just a bit of information on that. So I think it's very, very good that it is something that we talk about. In terms of what we can do as a clinic, I know that we have treated trans individuals in the past, and we are, like I said, we're very passionate about making sure that we are a welcoming and a warm and accepting environment for the LGBT community. Are there any common gender preferences that the medical field in general, I suppose, could perhaps improve on, such as changing rooms? I know we did mention pronouns. We could definitely, that's an easy thing to implement. Gendered toilets. Are there any things that, in your opinion, that the medical field can do? Small changes as well as big ones that can help with the sensitization and respect for the community.
I think, it is the small things of literally saying what name and pronoun would you like me to use? Because even if it's already obvious to you, it signals to the person that you're respectful. Wearing a little rainbow pin or having some little thing somewhere is immediately a signal, not just to transgender people, but gay and lesbian and people on all of these spectrums. So I'd say that is so helpful, because often people who aren't the sort of mainstream feel incredibly anxious, particularly in a clinic which is looking at fertility and sexuality. People feel on edge. You don't even have to not be mainstream. You can be mainstream and you're already feeling a bit anxious walking into the clinic. So really, these small signals can help, but then it's the obvious stuff. It is, as you say, it's toilets and changing rooms. Toilets, if at all possible, make them gender neutral is the way to go, as far as I'm concerned. And if there are disabled toilets, and I always use the disabled toilet because it's so much more spacious and usually more clean if I can go. But basically, transgender people also don't particularly want to go to a toilet that's called disabled all the time. But so, when people do build facilities, having gender neutral toilets, I think, is more helpful. It's tough on the women who are queuing to go to the ladies' toilets if there's a rush on the toilets, I've noticed. So but that's just my personal opinion. But in general, having gender neutral toilets, spaces that aren't typically one. I mean, I know from gay people who've gone for fertility treatment. They go into this room is called the masturbatorium, and there's a picture of a semi-naked woman on the wall. I mean, what's that about? Why not a picture of a semi-naked man and woman? I mean, maybe that doesn't happen anymore, but I've certainly heard stories like that one needs to be sensitive that not everybody is going to be the same in terms of looking around the space. So just walking through the spaces in the clinic and just thinking, could there be any issues? But it's not rocket science. It's basically toilets, changing rooms, and anything that's about, heterosexual or homosexual kind of attraction. Those are the three big things that one should be thinking about in physical things.
Thank you. I completely agree with that. And to set your mind at ease with regards to the content that are in those rooms, they are very inclusive now, which is great. So that's
great.
And then just in closing, Dr. Pickstone-Taylor, I received a few questions via email, which as we've been speaking, we have actually answered them. But most of them surrounded, the topic of if support is important for a trans individual, how do I support a trans individual? And, the one was about, I have issues, I might not necessarily agree with it, but I do still want to show support. And I think you've really answered those questions there with Support is essential. Being being respectful, being sensitive, asking someone what their pronouns are, and it's really the small things that really go a really long way, and to pay attention not to perpetuate the stereotypes that do exist with trans individuals. So I think we have answered all those questions. Are there any last comments that you'd like to weigh in on, or
maybe to add to those questions? People do have a tendency to feel, oh, well, they're gay, and then these people tell them all about their gay friends and that they're gay friendly or whatever. Yeah. Or their uncle is transgender. And actually a lot of gay and transgender and atypical, diverse people, they just want to get on with their lives. They don't want to hear about your transgender uncle or that you've got a best friend that's gay. There was a time that perhaps that was really important, but in this day and age, I would say just small signals are the most important, of a pin that's a rainbow pin, or giving your pronouns, and then people will know that you are a safe person to talk to. Yes, if you get to know them well enough, sure, but transgender people don't like to be asked questions like, oh, have you had the surgery yet? Would you ask that of a cisgendered straight person? What have you got down there? I mean, it's none of your business. So it's part of human nature that when we're confronted with something unusual or new, we're interested and we want to understand. But I think it's so important to be respectful and not to sort of, right, I want to be supportive, ask all the questions. Actually, just treating people as people and respectfully. Yes, it might come up that, as you get to know someone, by the way, if I'm doing something that's not helpful, please let me know. Saying something, very openly like that. But, the basic simple things are rarely supported. And transgender people do suffer from sometimes being asked too many questions and people constantly treating them. A number of the youth that I work with, once they've come out at one school and it's going well, they then want to go in stealth to a new school because they don't want to be the transgender child in that school. They just want to be a boy or a girl like everybody else and be treated respectfully. So I think we also need to just keep that in mind and treat people with decency and just think twice when you do have a question. Is this appropriate? Would you be asking this to a cisgendered person? And perhaps you would be, because you need to know, I don't know, for a camp or a getaway, if they're comfortable, with their room choice or whatever it is, or if there's anything else they need. But try to ask things in a neutral way, not in a way that says, okay, you're transgendered, so you're clearly disabled or have special needs, and how do we accommodate you? But there are nice ways to ask things and not usually rocket science to get there.
Of course, I appreciate that. That was very well said, and I think it goes around monitoring oneself, or society monitoring themselves to really accommodate, or not accommodate rather, but to help people within this community to live the normal human experience. They're no different to any other person. So I think it's important that those tips that you've given are really helpful for sure. And I think that's all that we have time for today. Dr. Pickstone-Taylor, I really want to thank you for taking time out of your busy schedule to answer all these questions and to really help us with providing this trans awareness with regards to fertility as well as the community. And you've been so helpful, and I really, really appreciate it. Thank you.
Well, thank you for your enthusiasm, and HART Fertility Clinic for their interest in this topic. But to me, it's just another level of depth of understanding of our patients that, frankly, every bit of healthcare needs to be aware of. So thank you for taking an interest and inviting me to share some insights.
Only a pleasure. And before we head off, I just want to let the listeners know to tune into our next installment that we're going to be doing, and it's going to be on surrogacy. All right. Thank you so much. Bye.